Hip mobility is essential for your body's health, not only at the hip level but also at the lumbar area or even the knee. It's one of the joints with the most mobility in the body and one of the joints we most often forget to work on. And it's normal that as the years go by, with the sedentary nature of our jobs, that hip becomes stiffer and discomfort, pain, and problems appear in all those related joints. Today I'm going to show you 3 hip tests that will help you find out if you have hip mobility problems. The first is the Thomas test, a test that will evaluate hip extension mobility, that is, when we move that leg backward. This test will evaluate the flexibility of the psoas muscle and can help us understand why lower back pain appears when there is a mobility restriction. Let's move to the couch or the bed because we have to do it in a special position. Are you going to need a chair like this or position yourself near your bed to let one of your legs hang off? We're going to lie down on that couch in such a way that our leg is bent at the edge like this with the foot resting on the floor. Since I'm very tall, I have to remove the cushion. I'm going to assess the extension of the left hip, and what I'm going to do is bring my right knee not so much toward the chest but toward the right shoulder, slightly outward. I'm going to push, push, push and stay lying on my back on the couch. And here, several things can happen. The first is that there may be some discomfort at the hip level, right here in the crease in the groin. This tells us that there is some kind of impingement at the hip level caused by some alteration in it. It could be osteoarthritis or different hip morphologies like pincer or CAM type, resulting in a femoral or acetabular impingement. This would happen if we had intense pain when bringing our right knee toward us, not so much toward the chest but more toward the outside, toward the right shoulder. Also some discomfort in the hip. Lie down, grab your knee, pull it toward the same side shoulder, and check if pain occurs in that leg from your lower back area. No, that's a good sign. If the opposite leg lifts up when you bring your knee to your chest, that's a bad sign. We need to improve the flexibility of that psoas, and we obviously have to evaluate both sides to know if it's something isolated to one side, which could explain the appearance of a pathology, or if it's something more systemic, general, that involves both sides. This would show that even though we have those stiff hips, we don't need to work on them immediately, since it could simply be part of our morphology. Let's do it with the opposite leg. I hug my left knee, bring it toward my left shoulder, and check again if there's pain in the groin area. Does the opposite leg lift up? No? Then we're good. Your hip is flexible, the test is negative, and you don't need to do any extra work. If either of the 2 cases we've mentioned happens, we would need to work on stretching the psoas and doing hip extension exercises. We'll cover all of this during Hip Week. As I've already told you, we'll dedicate an entire day to mobility exercises to improve all these limitations. The important thing is to test one side, test the other side, and see if there are any big differences. Because if that's the case, it's very likely that there's some kind of hip pathology and you'll need to start treatment as soon as possible. If the limitation is the same on both sides, it's more of a general systemic problem. You need to work on it, but that mobility isn't as urgent as if we found it on just one side. This has been the Thomas test, which helps us assess the involvement of the psoas and the limitation of hip extension. And now we're going to go back to the mat to continue with the Faber test. Very well. After finding out if we have a psoas that's too tight, if we have a limitation in hip extension, now we're going to move on to a second test, the Faber or Patrick test. A combined movement of our hip that will allow us to assess its movement in abduction when we move it outward and in external rotation. Pay attention because this is one of the most comprehensive tests you can do to assess your hip. The first step is to lie on your back on a soft surface. It could be a mat, a rug, or even your bed. The second step is to place the leg you want to evaluate over the opposite leg so that your ankle is right above your kneecap. Let me switch this camera so you can see it properly. My ankle, my lateral malleolus, is positioned exactly in front of the kneecap, which is that bone that sticks out at the level of the knee. Very small, circular, which is located just in front. My hip. In this way, my lateral malleolus touches exactly at the level of the kneecap. Let me switch cameras again so you can see it clearly. And from here, I'm going to slowly let that knee drop down. Very slowly, as far down as you can. Okay, two things can happen here. One, the knee drops perfectly and goes all the way down, or two, you get stuck up here. It's important that during the exercise your left leg and your left buttock don't lift off the floor. Lowering this knee often pulls the pelvis, causing us to end up in this position. Keep in mind that your left buttock and your pelvis always have to be very well supported on the floor. This movement or 4-point position helps us assess hip abduction and external rotation movement. Ideally, my right knee should be below or at the same level as my left knee. This would indicate that we have very good hip mobility. Now, if you have trouble getting that low, if your knee stays much higher, or if you feel discomfort, whether it's here in the lower back, right where the buttock is, or also in the pubic area, we would be facing a significant mobility problem. The muscles limit that movement, the mobility of the sacroiliac joint isn't right, which can cause this kind of discomfort. Let's take another quick look at it. We place our lateral malleolus at the level of the kneecap, let that knee drop down as much as possible very slowly. My left buttock doesn't lift off the floor at any point, and my right knee should be horizontal or even a little lower than the other knee. As you can see, in my case, I reach all the way down. I have very good hip mobility, which allows me to enjoy a hip, a knee, and a lower back without any kind of pain. As I told you before, it's always essential to evaluate the opposite side. So we do the same thing. We stretch the legs, place the outer malleolus right at the level of the kneecap, and let that knee drop. Remember that your right buttock shouldn't tilt, it shouldn't lift off the floor. It's positive if that knee is above the other one. It's very hard for us to lower it if pain appears in the groin or even if pain appears behind in the buttock. But it's important, it's possible that you're naturally stiff and that one leg is stiff and the other is also stiff and that no kind of pain appears. In these cases, there's nothing to worry about. It's normal anatomy. You should work on your mobility, but it's not urgent or essential for improving your quality of life. If you have significant pain or limited movement on one side or in one hip, then we would be facing a situation that will require immediate treatment. The sooner the better. And all of this, again, I'm not going to teach you here, but I will teach you during Hip Week, that event where I'll be live for 7 days. And there's a day dedicated to working on mobility to improve all these parameters we're seeing in these 3 tests. Okay, we've seen the Thomas test, we've seen the Patrick test, this second one, or Faber. And finally, we're going to look at the Ober test, a test that will show us if there's any kind of problem with the tensor fasciae latae, especially designed for all the people who have trochanteritis, pain on the side of the hip. For this, we're going to lie down. Let me move this out of the way because otherwise the mic comes off and you can't hear well. I lie on my side, rest my head on my hand, and bring my legs forward so that they're bent at about 80 or 90 degrees. Here at the hip with the legs, and I want to evaluate the leg that's on top. I'm going to move it back, stretch it out completely. I'll move up a bit more so you can see me clearly and stretch it out completely. And we're going to start at a level where we place that leg in line with the body. The farther back the leg is, the harder the test will be. From here, I'm going to slowly lower the leg, very slowly until it touches the ground. If you're not able to touch the ground, or if you feel significant pain on the outer edge of your hip, that would be considered a positive test. That tensor fasciae latae, which is a lateral muscle that runs from the hip to the knee, is limiting the movement and is contributing to the onset of trochanteric pain, trochanteric bursitis, or hip bursitis. It has many names, and that muscle would need certain stretches to improve its flexibility and reduce its involvement in this condition. If you don't have any discomfort, if you touch the floor and want to work a little more intensely, move that leg a little further back and reassess. For example, here I already feel much more tightness than if I'm in the middle. And again, these stretching exercises for the tensor fasciae latae will also cover them during hip week, so this video doesn't get too long. I lie on my side, legs at 80-90 degrees of flexion relative to my body. Extend the leg to be evaluated, toes pointing toward me. If you want, it's not necessary, and we lower it slowly if your foot doesn't reach the floor. Unfortunately, it's because that tensor fasciae latae muscle is limiting the movement. And it's necessary to work on its mobility and stretching, since it could be contributing to the onset of trochanteritis. Let's look at the other side, since we always need to consider both. If the same limitation is on both, it's less serious. Foot, no. Up to... Unfortunately, it's because the muscle that's limiting movement needs its mobility. Slowly, 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 slowly. Look, I'm better with this leg. I have less tension. Once it touches the ground, it reaches the ground. Unfortunately, the fascia muscle is limiting the movement, and it's necessary to work on its mobility. Not all the way to the ground. Unfortunately, it's the muscle. It's limiting. Not all the way to the ground. Unfortunately, it's the muscle. It's limiting your movement, and you need hip mobility to improve your quality of life. So if pain appeared during the first test you did in the groin area, or if your leg lifted up a lot, if in the second one your knee didn't go down or you felt pain in the groin area or behind near the buttock. What if in the third one you felt pain on the side or your leg didn't reach the floor? I strongly recommend that you sign up, because I assure you it could even change your life just like that. I wholeheartedly thank you for making it to the end of the video. I hope you can share it with anyone who has hip limitations, pain, because I'm sure it will help them open their eyes and learn to identify one of the many factors that can cause hip pain. That's all from me. I say goodbye, hoping to see you live on April 21st on the first day of Hip Week. And if you can't make it, I hope to see you in another video. Bye, friends.